why is it? Well, why do you think the advice should change to women who are pregnant abstaining completely?
The evidence is very clear. If you don't drink, there's absolutely no risk your baby will be damaged. That is the safest option. If you drink moderate to large amounts, we know that alcohol causes damage to fetal growth and development. What we don't know for an individual woman, and what we'll probably never know, is the level at which that damage starts. It may start at 1 drink, it may start at 2. We simply don't know.
I mean, you said 2 key words. You said moderate to large amounts of drinking. I mean, anyone who's got some common sense would agree with you. But 1 glass of wine a week, is that going to damage a baby?
The answer to that is we don't know. There's total uncertainty about what happens at very low levels of drinking. And what the rest of the world have decided is that the safest thing for pregnant women is to abstain completely. I think people here in Britain don't realise that we're kind of 30 years behind the rest of the world with our guidance. There are now, at the last count, 35 countries across the world whose advice is, if you're trying to get pregnant, if you are pregnant, if you're breastfeeding, don't drink.
The problem is, and again, you're right, it's just mixed messages, isn't it?
Absolutely.
I am pregnant. I have had a glass of wine or 2 during my pregnancy, not much. I would hate to think that that's damaged my baby in any way, but there are certainly other doctors and paediatricians who are equally as talented as you who say there's no robust evidence that drinking after 12 weeks is harmful. Therefore, who do I listen to? Exactly.
And one of the points I wanted to make was that the NHS, with its confused guidance, is actually making things very difficult for pregnant women. They simply don't know what to do. They drink a small amount and then they feel guilty about it, and then they worry that they might have damaged their baby. And I think what we need is clear guidance. It won't take away women's choice, but actually clear guidance from doctors I think people would find helpful.
Mary, I mean, we've had lots and lots of messages on this. I have to say a lot of people do agree with you. Matthew, men and women, saying shouldn't be allowed all cigarettes. Teresa saying not even a glass of wine a week. Get pregnant and wait until you have your healthy baby. But then the likes of Jennifer via Facebook are saying, actually, sorry, Maria saying it's up to the woman, but as long as they're okay and they're not drinking every day. I suppose the question is whether the NHS are going to change their guidelines, aren't they? Is there enough of a groundswell of opinion from doctors like you to force them to change the guidelines?
I think we're getting there. The BMA this year said that abstinence was the right way in pregnancy. The Royal College of Midwives now tell women to avoid alcohol, but unfortunately the Department of Health and NICE and the Royal College of Obstetricians have taken a different view.
And you've had 5 children.
Exactly.
Did you drink any alcohol during those pregnancies?
No, I didn't. And actually, it's interesting what you say. I don't know a single doctor that drinks in pregnancy. And I do wonder whether we're in the same position we were in the 50s when all the doctors stopped smoking and it took the rest of the world 10 years to catch up.